Sperm tests are unreliable. For example, I took this sperm test on 13th Feb 2025 in Apollo Specialty Hospitals. Now, any sperm test looks for three things: sperm count, motility, and morphology. I'll explain this later. But if you look at sperm count and morphology, my sperm count is 102, which is greater than 20, and my normal morphology is 85%, which is greater than 30. I basically have very good scores. But if you look at my second report, which was done in September 2025, basically this month, just 6 months after the first test, in this lab called Newberg, my sperm count is now 30, which is just barely crossing the 15 mark. And my normal morphology is now 40% instead of 80%. So in just 6 months, my sperm count dropped from 100 to 30, 70-point drop, and my morphology has become half from 80% to 40%. Like, this is really, really scary, right? So immediately the next day, I went to the doctor, taking all the reports, and I went to him. I was panicking. I was like, because I have this condition called varicocele. It comes in 15% of the men, and in most of them, varicocele doesn't cause infertility. But when it does cause, you need to immediately get a surgery called varicocelectomy. So I was taking these regular sperm tests, semen analysis, and if my scores are dropping, then I need to get the surgery done. If it is not dropping, then I don't need to care. Basically, it's like appendicitis or it's like hernia. Only when it ruptures, it's a problem, but otherwise you can continue for many years without getting the surgery done. So seeing all my scores were dropping, I thought I need to get my surgery done, and I was really panicking. So I went to the doctor and I showed the reports, and he was like, actually, your scores are normal. So in both reports, even though there is a drop from 100 to 30, that 30 is still above 15, the normal range. So even in this report, your sperm is still healthy. It is crossing all the normal marks. So as far as I am concerned, your semen is still healthy. You can go back home. I was like shocked. I was like, doctor, look at the scores. They're like, even though I'm still passing, even though I'm above the pass mark, there is a huge drop. From 100, I've dropped down to 30. I'm like explaining with so much expression. I'm like asking the doctor to wake up, like, why is he not taking this seriously? I really didn't understand. And then the doctor was like, this report was done in a different lab, Apollo Hospitals. And this report was done in a different lab, Newberg. So reports from two laboratories cannot be compared. I was shocked. I couldn't believe what the doctor was saying and I couldn't understand at that time. But I left and I did a lot of research and found these two research papers: high variability in results of semen analysis and effects of ejaculatory frequency and season on variations in semen quality. So basically, there are two types of variances that occur in semen analysis. So one is intra-lab variance. So basically, if you go to a different lab, there is a variance. Same semen, you give half of it to one lab and half of it to another, you'll get two different results. Intra-lab variance. And the second thing is intra-individual variance. Basically, if I give sperm today and if I give sperm to the same lab, I give sperm today and 1 week later, those two results will be different. So there is intra-individual variance and intra-lab variance. So when you account for both, so basically what the paper says is, so intra-lab variance can go up to 60% when it comes to sperm count. 60%. So in one lab, if you get a score of 100, in another lab, you can go up to 40. 60% drop or increase, whichever way. And second thing is, in intra-individual variance, the drop can be up to 40%. So this is not always the case, but this is the maximum range, maximum amount of error that can happen. So in my case, I don't know if I got 60% of error in intra-lab and 40% of error in intra-individual. I don't know. You don't know. Nobody knows. But this is a maximum range of error that you can get from two different labs or from two different samples of my own. So in the best case, for or let's say in the worst case, I got 60% of error across labs, 40% of error across two samples. So total, it is almost going to 100. So my drop is just 100 to 30, 70 drop. So maybe I can actually explain this just as an error or noise from two different labs and two different samples, right? I can say that, but I would be wrong because we don't know how much error occurred, and we also don't know what is the type of error that occurred. So error can be both positive as well as negative. So maybe the 30 is actually the right score and the 100 was the wrong one. So the 30 was like overestimated to 100. So error can be positive or negative also, right? Error. So I can also, so I can't always imagine the best case scenario and say the 30 was the error. Actually, my score is like some 60 or 70 or 80, and they have like made some error in counting. So this is the most important point that I want to make, which is there is the amount of error which is possible in the worst case scenario. People have seen there are research papers online. I will share the links in the description. In the worst case scenario, you can go up till 60% also. You can go up to 40% also. Two different types of errors, and you can combine them, and you can go up to 100% of error. You can actually see in your reports, two different reports. But that always doesn't happen. Maybe you in your report there is 20% of error, or maybe in another person's report there is 10% of error. So we actually don't know the amount of error that is actually happening to us, and we also don't know the direction of error. We don't know if it is an underestimation or an overestimation. We don't know if it is, if we are healthy and we are getting an unhealthy report, or we are unhealthy and we are getting a healthy report. We actually don't know any of those things. So these are, so this video is about explaining you the tips and tricks that you need to follow in order to make sure that you can, or in order to make sure there is less variance in your reports, and also what kind of a mindset or thinking that you need to have when you compare one report to another. Because semen is a very sensitive thing. Like if we lose semen, we are losing fertility. If we are losing fertility, we are losing the opportunity to marry, we are losing the opportunity to date, and we are losing a lot of stuff. We are losing the ability to give birth to a child, right? So that's a huge deal. And when there is a lot of variance, and without having this knowledge, if you start looking at two reports, you'll get panicked a lot. There is a lot of emotional turmoil that will go on if you don't understand semen analysis and the variance involved in semen analysis. So this video is to help educate you on this matter. So first part is explaining the three sperm parameters, basically sperm count, motility, morphology. Second part is explaining intra-lab variance, why that occurs, how, what you can do to reduce that variance. Third is explaining intra-individual variance, what you need to do in order to make sure your variance is less so that your results are consistently showing what is actually happening inside. And fourth one is a summary. Fourth one is repetition is king. So basically, you need to take these tests 2-3 times and you need to average the results. You can't just blindly take one result as the gold standard of truth. So that is the fourth point. So these are the 4 tips that I'm going to share in order to help you understand your semen analysis report. So let's get started. Part 1, sperm parameters. So let's start with the easiest parameter, sperm count. So if we take the semen, if we take just 1 ml of that semen, then in that 1 ml, we are trying to count how much sperm is there. And basically there is, what we find is millions and millions of sperm. And this number in your report is basically telling you how many millions of sperm is there in 1 ml of your sperm. So my two sperm reports, 130, are basically 100 millions per 1 ml and 30 millions per 1 ml. So this is basically the quantity of sperm. How much sperm is there in your semen? But the next two parameters, motility and morphology, they are about the quality of sperm. So if we take motility, basically in motility, we are trying to see how good our sperms can swim. So there are 3 types of sperms. There is fast swimmers, there is slow swimmers, and then there are non-motile. Basically, they don't even swim; they just stay in place. Now, this is the bad type of sperm, but the other two are good type of sperms. So if we look at our report, My rapid progressive is the fast swimmer, then slow swimmer, then no swimmers. So basically looking at this star, I actually got scared in the beginning because the normal value is 50 and mine is just 15. So I got really, really scared. I thought the star is because it's abnormal. But if you look closer, this is A and this is A plus B. Well, what is A and what is A plus B? Well, basically A is the fast swimmer and B is the slow swimmer. So the second reading, this is not how many slow swimmers there should be. This is basically fast swimmers plus slow swimmers. So basically 60 plus 15, 75. That should be greater than 50. That's what this report is saying. So don't get scared when you look at your sperm analysis. The first one is measuring how many fast swimmers there should be. So I have 60, which is greater than 25. But the second report is actually checking how much total swimmers there should be. It's not checking how many slow swimmers there should be. So this is a small caveat that people miss. So basically total 75 swimmers I have and 25 I have non-motile swimmers. This is the bad kind. Now that is about motility, but the next one is morphology, and morphology is basically the shape and size of the sperm. So basically, sperms need to have this oval head. Sperm actually has a head and a tail. And if you look at the head, it should have this oval shape, which is like medium size. But there are sperms which have pin heads, small size, and there are sperms that have giant heads, big size. So small, medium, large. We want our sperm to be medium size. So if you look at our report, my normal form is 85%, which is greater than 30. Very good. But pinhead, small size, is 2%. Giant head, large size, is 3%. And then the tail is bent in some of the sperm, that is 5%. And the middle piece is also enlarged in some, 5%. So totally together, 85% normal oval headed, good looking tails and good middle piece. The normal form is 85%. But the error, that the sperms with errors, that is 15%. So this is how you read your sperm analysis report. Sperm count, motility, and morphology. Now let's look at variance. Part 2, lab variance. Or in other words, lab error. Now if this lab error, which can go up to 60%, comes from three sources. First source is the type of equipment used to count the sperm. So there is some many different types of equipments I will show you. And second source is the kind of technician who's doing the counting, because the entire counting process is not automated. There is some manual step involved, and depending upon the technician used, the counts change. And the third source is the kind of lab that you use. How famous it is, how popular it is, matters. Let me explain. So if you look at the first source, so basically there are these chambers called Makeler chamber, Newber chamber, hemocytometer. So there are different types of chambers used to count sperm. And based on the type of chamber that they use, the counts differ. So like some 5-10 points here and there, each chamber changes the reading, the report. And similarly, in order to count the sperm, they use this dye to stain or color the sperm, because sperm is not visible, right, on its own. So they use this dye to make it visible. And this dye, also there are many companies offering the dye. So based on the dye you use, the counts may differ. So some of the sperm may not be visible to you in the dye that you use. So chamber, dye, there is a variance in both. So each lab has their own chamber and has their own choice of dye. Since this sperm analysis is not yet regularized or standardized by the government, each lab is using their own choice of companies and chambers and dyes. So that is the variance coming from the lab because of this. And source 2 is because of the technician, like I already said. Now what is differing from one technician to another is how strict or how lenient they are. So back in school, you would have seen teachers. There'll be the strict teacher who will be like, even for a small mistake, will cut marks. But there'll be lenient teacher who will be like, yeah, this is also fine, this is also fine, and gives lots of marks, right? Same thing happens in semen analysis, where some technicians are really strict. Even small defects, they consider that as a damaged sperm and they don't count it. But some technicians are like more lenient. They count this also and that also. They're like, oh, this is fine, this is fine. So from technician to technician, there is subjective differences in what they consider to be a healthy sperm and what they include for counting. So this difference also will give rise to some 10-15 points here and there differences from technician to technician. So first source gave 10-15 points of difference, second source gave 10-15 points of difference, and third source is how famous the lab is, because this sperm counting is basically a skill. It's an art form. So you need lots and lots of practice to get good at it. For example, my YouTube videos, I was really bad in the beginning. Now after 70 videos, I'm little bit better. 70 more videos, I'll get even more better. So similarly, this is like an art form which requires a lot of practice. So in this research paper, they found that labs performing more than 200 semen analysis per year. These third tertile laboratories, basically high frequency laboratories, had the lowest mean bias values. Basically, they had the lowest error, while the low activity laboratories had the highest error in terms of sperm count and other categories. So basically, you need to, there are, in my own street, there are two kinds of labs. One is the Newburgh lab that is like really big, very famous, lot of traffic, lots of people going for tests. And then there is another lab, smaller lab, cheaper lab, where only a few people go in. But for all other tests, like blood tests, urine culture, any other kind of test, I can use the smaller laboratory, which costs less. But when it comes to semen analysis, I need to always choose the Newburgh or any other Apollo hospitals or any other famous branded where lots and lots of people go in, so that the technicians there have seen lots and lots of semen samples and their skill has uplifted, so that their variance in skill level reduces. So now that we understand these three sources of error, how do you reduce the variance to the minimum? Well, choose a lab that is famous. That is step one, very obvious. But step two is give the semen sample to the same lab again, so that the same chamber and dye are used. And third thing is give the semen sample at the same time again. Because if you give it at a later time, then the technician may change. Because he might have a different shift and he might go home and you might get a different technician. So we are trying to make sure that the variance is the lowest. So by taking a very famous lab, we are taking a very skilled technician. By giving the sample at the same time, we are making sure we are getting the same technician again. And by choosing the same lab again, we are making sure the same chamber and same dye are used to count the sperm. Now, by making sure all these things are same, we are reducing the variance. And if you're still seeing a drop in your sperm count, then that is because there is a problem with you. You see, because because otherwise you will get confused, right? If this variance is still high and it is going up to 60%, then it just messes with your head. So try to reduce this variance as low as possible. And then whatever differences you see in your report, you can always attribute them to yourself. Which brings me to part 3, individual variance. Now, individual variance can come from 5 sources. That is right, 5 sources. First source is fever. I got fever. So last month, August, I had fever. That's why my semen sperm count has reduced. So you should not get fever. So if you are taking sperm test now, and if you're taking sperm test 3 months later, then within the 3 months, you should not have any fever. If you have fever, then let the fever go away. Wait 3 more months and then take your semen analysis, because fever wrecks your report. Even though there is not really any problem within yourself. So first one is fever and second one is heat. In fever also your body gets very hot, right? So heat can also come from external sources. So for example, somebody can go to some sauna, some hot steam bath they can take. Or in my case, I used to, in order to manage my varicocele pain, I used to wear these underwears, very tight underwears. I used to pull them up all the way up in order to like try to like they say that gravity pulls the testicles, and if that weight or gravity is removed, then I might my pain from varicose, that pain I get from varicose, that might reduce. I heard somewhere I started wearing underwears. I was wearing them very tight, but that increased the heat of the testicles, and that heat can also reduce the sperm scores. So I had both fever and heat. Don't do that. And third one is alcohol. Fourth one is medicines. I don't know which medicines affect the sperm. Your doctor would know. And alcohol also affects with the sperm. So what you intake, alcohol, medicines, what you intake, and fever and heat, both of them will end up heating your testicles. These things will incredibly wreck your scores. And the fifth one is abstinence. Abstinence meaning if you gave your sample now, how many days before you masturbated? When was the last time you masturbated? So what they ask for is ideally some 4 to 5 days they ask for, because if I masturbate today and if I masturbate tomorrow and if I give the tomorrow sample to the lab, the scores will be less in that sample. The reason is okay, I don't know that much science in order to know the reason, but the point is if there is 0 days between two masturbations, then sperm count is very low. But if I give one more day, sperm count increases. 2 more days, 3 more days, 4 more days, sperm count keeps on increasing. But after 7 days, what happens is your motility and morphology starts to go down because these are like old sperm or something. I don't know. So I didn't go research very deep into this, but ideally not very close to your previous masturbation, not like 0 days because that will completely plummet the sperm count. Not very far because more than 7 days, your sperm count may be high, but motility and morphology will get affected. So try to aim for some 4 to 5 days. And if one test you took it in 4 days of abstinence, make sure the next test also you take it in 4 days of abstinence. Don't make that 7. Don't make this 2. Then there'll be a lot of variance. So, in order to reduce, long story short, in summary, to reduce your individual variance, make sure you didn't have any fever in the last 3 months. Make sure you didn't do some activity that increase the heat in your testicles, like wearing underwears or going to hot sauna, steam baths. Don't do that. Make sure that you have 3 months of clean history. Make sure you didn't have take alcohol or any drugs or medicines in those 3 months. And just before giving the sample, make sure you have an abstinence period of 4 days or 5 days, whatever you choose, and make sure you stick to that 5 days again when you take the next test. So these are the 5 things you need to make sure you reduce individual variance. So part 4, repeating the test by reducing all the variances. So, so take at least 2 tests minimum. So make sure you have 4 days. Let's say you took 4 days of abstinence, you took a test. Then again wait 4 days, again take a test. 2 tests of 4 days abstinence. Collect them. This is minimum 2. But if you are willing and if you have a lot of money, then go for 3 and take the average of all 3. This will completely reduce all kinds of variance. You will get a mean. So in maths, you have studied mean and variance, right? So you get the mean average. And since you followed part, I don't know, part two. Yeah, since you followed part two advice, the lab variance is reduced. Since you followed part three advice, individual variance is reduced. And still, if you are seeing some reductions and if the sperm count is going down or going up, then there is some problem within yourself that your urologist will correct. So I hope this video helped because I didn't know all this and I was like losing my mind over the sperm test results. I hope this video helps you in understanding and interpreting the values and what you need to do in order to make sure that you don't screw up the values for some dumb reasons and you screw it up only because of some diseases going on inside, so that you address them quick, act fast, and get a resolution quicker, because this is semen and semen is really important. See you in the next one.